So the next exercises or movements that we're going to look at in terms of helping decrease risk of injury is neuromuscular control, also known as balance. So there's several different ways that you can incorporate balance into your training and routine to help minimize risk of injury. So we'll look specifically at single leg balance in terms of using the upper body and lower body with just body weight. And then we'll look at ways that we can increase difficulty with transition to using props, so like a medicine ball or a kettlebell. So the first one we're going to do is a single leg balance using the arms. So we're going to do a crossover reach motion side to side. So you're going to use your right arm and reach towards your left side, left arm reaching towards your right side. Other exercise that you can incorporate just specifically body weight is the lower extremity. I like to use what we call a step matrix. So we can do what we call an anterior step down, a lateral step down, and a posterior step down. So meaning we're going to be moving our leg to the front, to the side, and then to the back. So you can do this all in a mix, front, side, and back, or you can incorporate it just doing to the front, 10, 15 reps. You can do to the side, 10 to 15 reps, or to the back. So your positioning is all looking at ankle stability and strength, maintaining that position on a single leg position. Another way to increase the demand of neuromuscular control or balance is adding props. So we'll be using a medicine ball or a kettlebell for this demonstration. So with the medicine ball, similar to what we did with the upper extremity, we can do a chopping motion. So same thing, we can bring our arms up to the side, chopping down, and then we can do that same thing to the other side, chopping down as well. We can do a reach forward motion and coming back, or we can do a reach down towards our foot and then coming back. So these are different ways you can use a medicine ball. But one of my favorites is the kettlebell pass. So using a kettlebell, we'll be balancing on one leg, holding a kettlebell in one hand, switching to the other side. Start out with a light weight with this. You can also use a dumbbell, but kettlebells add a little bit more dynamic control with that side-to-side motion. That makes it a little bit easier for the transfer, but a lot more challenging on the body to maintain that balance on one leg. So same thing, try and create that stiffness in the body, the ankle, knee, and hip, to try and maintain that balance on that single leg.